All right, so when we talk about the dissolved oxygen or the dissolved CO2, the most important blood gases in blood, we refer to it as partial pressure. And the reason we refer to these as partial pressure is because air consists of many gases. So when you talk about a concentration of one of the gases that is present in air, you're going to refer to it as its partial pressure. Oxygen is not the dominant gas in our atmosphere. It's nitrogen, but it is a significant portion of our gas. So some example concentrations that you might see in the atmosphere is about 104 millimeters of mercury of oxygen and about 40 millimeters of mercury of CO2. Now, what am I referring to here? If we think about air pressure, 740 millibars or something of that sort. 104 of that is the oxygen. About 40 of that is the CO2. So when we talk about the oxygen that's in our atmosphere and also the oxygen that's in our blood, what is going to cause that oxygen that's in your lungs from ventilation, what is going to cause it to move into the capillaries is simple diffusion, a movement from an area of high concentration to an area of low concentration. So it's the partial pressure of oxygen in the atmosphere in your lungs versus relative to the partial pressure of oxygen in your capillaries. Now, when the deoxygenated blood returns to your capillaries in your lungs, you're down, maybe at 40 millimeters of oxygen. So there's a large concentration gradient. So we have this 104 millimeters of oxygen. So this is going to drive the simple diffusion, pushing oxygen into your blood plasma and having it picked up, by your hemoglobin. And similarly, there's not as big a difference. There'll be like around 45 millimeters of that concentration of CO2 in the deoxygenated blood, and so you'll release the extra CO2 into your lungs. And so every child knows you breathe in oxygen and you exhale CO2, and that's what we're talking about here. In the next slide, we're going to talk about how oxygen and CO2 are carried in the blood.